Hi everyone, welcome to our physiotherapy module for pelvic pain. We have made this because these are the key bits of information and exercises that we often give to patients over multiple appointments. And the feedback has been that many patients wish they had this advice earlier or before they started so that it could potentially save them the amount of appointments they needed to have, and it could give them something to start while they're waiting for appointments as well. So I hope you enjoy and take some things out of this. We also have some tips on how you can try and write down or keep note of your symptoms so that this can help us in our initial appointment to better understand you and your pelvic pain and how things have evolved with time. So firstly, we are on Larrakia land, and I would like to pay respect to elders past, present, and emerging. And I'm just very grateful that we're on this space in this lovely clinic, Northside Health, so that we can hopefully impart this knowledge on everyone who's accessing our pelvic pain and endometriosis service in the Northern Territory. So Firstly, I just want to say that many of you might feel that they need to watch this in chunks instead of watching it all at once, and that's totally fine. Whatever type of learner you are, often we like little micro bits of education, but this will all be presented at once, and just break it up as you need. Please, if you haven't already, download and print the workbook that we have made for you. It has key bits of education that we go through in this presentation, so you can underline or star or highlight things that are relevant to you. It also has spaces in there so that you can write down things about you that will help us to understand you better. And it's something that we've made so that hopefully you can have a beautiful guide to help you throughout your journey here and onwards. So we are going to go through all the different types of pain that we see in the clinic and how we like to address those. We're going to go through the basics of anatomy, so about your pelvic floor muscles, your other muscles, your abdominal muscles, and key signs of muscle dysfunction with pelvic pain so that you can hopefully identify, hey, this might be me, and understand how the pelvic floor and the abdominal muscles often work together, and not in a great way when it comes to pelvic pain. There's going to be practical suggestions for helping improve coordination of your muscles, learning to let them go. This is the bread and butter of pelvic physio. And we're going to talk about the pelvic organs because this is something that we as pelvic physios go through to help optimize the health of your bladder, your bowels, and also the vaginal area. So working on bowels is a key part of our management and often is affected for people with pelvic pain. You'll see some practical videos of how to do key stretches and mobility exercises that we give to our patients, and we often don't have time to go through them all. We'll go through how to access pain relief that isn't medication, so using a TENS machine. We'll talk about our cycle if you have one and how it can influence our month and how we exercise. We'll talk about the nervous system and how this relates in pelvic pain and with physio. And we'll go through a lovely body scan that hopefully you can learn and add to your tool belt to help with pain management. We talk about a pelvic pain toolkit, which is super important when you have flares. You want to have options of what to do. And importantly, we'll talk about resources so that you know where to go from here while you're waiting for an appointment, or instead of having an appointment if for some reason you're not able to have an appointment here with us. So the whole aim of this workshop is to learn more about anatomy and kind of what might be going on with you, identify how this influences you and your management, so that you can let us know what might be going on, to practice and form some skills, to come up with a plan. We love coming up with a plan, whether it's plan A, B, and C, and an emergency plan or a flare plan as well. And hopefully then you can come in and engage with our service once you've watched this and maybe tried to give some things a go, so that we can then know, hey, I've tried this, but let's see, what's going on, maybe why is that not working, and make our treatment individualized for you. Then it's important to follow up with the clinicians that you're engaging with here. And ideally, we want you to feel like you're independent in managing your pelvic pain. So, firstly, I would encourage you to access your workbook. It's page 5, and identify what are your goals. What are your goals with our service, short term and long term? We would love for you to also note down what symptoms you have in your workbook, and we will talk about timelining and why that's important so that we can understand how your pain and your symptoms have evolved over time. You'll see here that we've got the biological, the social, and the psychological aspect of someone. These factors really do influence how someone experiences their pelvic pain, and often influences our approaches and how we help someone with managing their pelvic pain. It's important that we're not just focusing on someone's anatomy. So that's your organs, your muscles, your nervous system, but we're also considering your social factors, your psychological factors, as they all really do affect how well someone's going to do with current strategies, or what we might need to bring in and help a patient with. Sorry that my video's blocking here on the psychological circle. The thing that's cut out is mood. So evidence shows that we really want to understand the patient across all of these 3 areas of self so that we can know how is pain processed and hopefully reduce how the pain is felt and your fear of pain. So in this workshop today, in the Physio Module at least, we're going to be going through a lot of biological things, and we've got a psychology workshop, and psychology and engaging with a psychologist also really considers your social factors. We consider it with your management as well, and we try and make the most of those, of your support system to help you, because we often need the help of others when managing pelvic pain. So this is a slide about common things we see in clinic and with pelvic pain, and we're going to talk through them so you can identify if you think you have them. Let us know. And importantly, on page 15 of your workbook, once you've identified if you think you have them, or if you do have them, we would love to know that timeline. How have things progressed with you? When did they start to appear? Because seldom in pelvic pain do we have just one thing or multiple things happening all at once. Usually it's that things have started, maybe you started off with 1 or 2 symptoms, and then at this age you experience this, and at another future age you experience this. So we want to know that because it does influence how we actually actively treat you in physio and medically. So let's start. Dysmenorrhea is period pain, so painful periods. We want to know, did this happen ever since you got periods? That's primary dysmenorrhea. Or was it something that happened later on, and how old were you? There's bladder pain syndrome, which is when you have pain with filling up your bladder, so as it gets full. There's bladder urgency, which is just urgency, struggle holding on to your bladder. You may or may not have leaking with this. And there's irritable bowel syndrome, which is commonly a reason for bloating. And we want to know what this means. Do you have IBS-C, which is with constipation, or do you have loose stools, diarrhea often, or do you have a bit of both? We also definitely want to know if you have recurrent thrush or UTIs, and even sexually transmitted infections that can flare every so often, because those can be causes of pain as well. And there's dyspareunia, which is pain with inserting something in the vagina. That's technically, dyspareunia is pain with sex, but we also want to know, do you have pain with inserting other things? And is this pain at the entry? So superficial with trying to insert something, or is it just deep pain? So there's superficial and deep dyspareunia. Vulvodynia and vestibulodynia are something that are commonly missed, and it's really important that we know if you have this. So, for instance, vestibulodynia is that there's pain with light touch around this vestibule area, and vulvodynia is there's pain anywhere around your vulva with light touch. That's important for us to know and needs management for sure. There's vaginismus, which is a term for when your pelvic floor muscles are tensing when anticipating pain. So usually it's when you're trying to insert something in there. That could be sexually, with a tampon or period cup, or even with a gynecological exam, for instance. And of course, there's the conditions that we often see associated with having a uterus or ovaries. So there's endometriosis, polycystic ovarian syndrome, adenomyosis. If you know you have those, let us know. And we can also, of course, look into diagnosing things like this, the doctors, I mean. And there's fibroids, which can cause pain with periods as well, and usually heavy bleeding. And I've also added in some things here, so it's helpful for us to know if you have any other hormonal conditions or abnormal hormones, if you're hypermobile, if you have any nerve, nerve pain or conditions around nerves. So when you come in for a physio appointment or an initial GP appointment, you might see us refer to this piece of paper we have where we go through the different types of pain and management options for them as well. So there's the pelvic organs, your uterus, your rectum, your ovaries, your bladder, but then there's the muscles. There's the nervous system and the nerves, your brain, and there are the hormones. In this presentation, I'll talk about what's normal, signs of dysfunction, and importantly, what this can mean and how we can help in our service, whether that's with the doctors, the physio, psychologist, dietitian, and hopefully you can have more of an idea of what's going on with your biology. Let's talk about pelvic floor. So we have muscles at the entry of the vagina or the anus, and these muscles are supposed to be able to stretch, to insert or remove things. They're supposed to be able to contract. So these muscles help to hold in urine. These muscles help to hold in poo and wind. And they're supposed to be able to contract with arousal and with an orgasm. And they should be able to do all of that without pain to an extent, right? Then we have so we're, especially if we're trying to insert things here, but then we have the deeper layer. So we have the deeper layer, which goes around the vagina and around the anus as well. And it actually attaches from the pubic bone to the tailbone. And this muscle layer is supposed to support our organs. So we've got our organs, our bladder, our uterus, vagina, and the rectum. And it does have a bit of another role as well. So it can help in helping to hold in urine, and it definitely is really key. So this deep layer that wraps around your rectum, it's extremely key for pooing properly. So it goes around the rectum like this. And in order to pass a bowel motion, we need to be able to relax that properly. Our job as pelvic health physios is to figure out what's going on with these muscles. So these symptoms are quite common with pelvic pain, and it's our job to figure out what's happening here. So you can have muscles that are hypertonic, which means they're two-toned, not in a good way. So muscles that are high in tone are often painful to touch. They might feel sore or bruisey. They often struggle to stretch. And when they're stretching, that can feel like a burning sensation or really painful stretching feeling. And when they're too tense, they lack blood flow, so they're more prone to spasming. And that sudden that sudden, sharp, spasming pain. Then we see muscles that are overactive. So when we have muscles that are overactive around your pelvic floor or the vaginal area or anal area, they're often quite good at turning on, but slow to let go. And we have certain strategies for this. So when you have overactive muscles, and you can have that of your abdominal muscles too, they are guarding all the time. And our muscles in our pelvic floor area or in our abdomen, they should be able to turn off when we don't need to use them. And unfortunately, when you've been used to having pain for a long time, it's what our brain is teaching us is a protective response. So our brain wants us to keep them on quite often or all the time. But that's not helpful for pelvic pain, for inserting things, for being able to do all of, your daily functions or hobbies without pain. And it's a bit of a vicious cycle. So the overactive muscles can cause them to be high in tone. And if they're really sore and painful, then they can be overactive. So we want to try and interfere with that pathway. And then often we might think, well, my muscles are really toned, they must be strong. But muscles that are high in tone can also be quite weak. And so people can experience leaking as well, and weak muscles, even though they're toned or overactive. And then we can have very poor coordination with our muscles. So we don't know what's on and what's off. We struggle to turn it off, we struggle to turn it on, and we should be able to do that. So that's what we look at and look for and try to help our patients with, and it's key for pelvic pain. So common symptoms of muscle pain is a stabbing pain in your abdomen or your pelvic area, just a general ache in your pelvis, and especially after flares or painful activities. It could be sexual, it could be even exercising. It could be that you have pain with movement or being in certain positions like sitting, or if you've been in a position for too long, prolonged standing, for instance. And often muscle dysfunction in pelvic pain means that you have trouble emptying your bladder or your bowel. You might have trouble emptying at first or continuing to have a full motion. And you often have troubles inserting or removing things into the vagina or anus, and that's non-sexual or sexual. So these are common signs of muscle pain in your pelvic floor or just in your general pelvic area. Other muscles we look at and we want to try and figure out if they're too toned, overactive, weak, are the abdominal muscles here, the hip muscles and your hip flexors here, and your inner thigh muscles and your outer hip muscles. So the muscles around your glutes or your hip, these commonly are affected with pelvic pain, and that's our job, is to try and help you to learn how to let them go, stretch them, and also release them if that's needed. Alrighty, so we have a relationship between our pelvic floor muscles, our deep abdominal muscles, and a muscle that a lot of people don't know about. It's called the diaphragm, and that's underneath your lungs. So when you breathe in and expand, the diaphragm is going down, and your pelvic floor muscles actually are supposed to just soften a little bit. It helps for your pelvic floor to soften even further if you're breathing in and widening your belly out, like in this diagram. So this is something that we use a lot when people have muscles that struggle to let go or that are more toned and painful. So when we breathe in, we widen our belly, we're expanding our lower lungs, and that helps your pelvic floor relax. And then when we exhale, the diaphragm comes up, the pelvic floor does just activate a little bit more, and your belly comes in. So belly breathing is really key for helping your muscles let go. You can try and do this when you're experiencing a spasm, especially. It can help your muscles to turn off when you feel like you're not in control of that. And I love recommending that people put a finger or their fingertips touching on their lower belly. So essentially, sorry, I know it's going a bit blurry. I will get people to relax in a chair. Often I'll demonstrate this when people are laying down on my plinth and we've got a nice foam roller under the knees so people can kind of relax in what I call a butterfly position. And we put our fingers here and you can see if someone's doing this well, you should see the lower belly expand and the fingertips do just that. If you experience any pain with belly breathing, so often people might experience pain at that very end of that breath in, it could be because you might actually be trying to push your belly out a little bit too much, and it can be causing a contraction. So let's not think of it as forceful expansion, but just like a gentle widening. If you experience pain, I'll say, okay, well, let's go to 70% instead of 100%. That's fine. And you can do belly breathing in a chair, relaxed laying down on your back, on your side. And I encourage people, and you'll see later in this module, to do it whenever they're doing stretches, because usually that's when people will tense up their muscles when they're trying to stretch as well. So usually when you come in here, we are without a doubt going through belly breathing. So we would love if you would try this, see how you feel, and then we can troubleshoot if you are experiencing any difficulties when you come in for a one-on-one pelvic physio appointment. Alrighty, so we've just spoken about belly breathing. Now, I want to speak about the specifics more and how often, how long we recommend that you do this for. If possible, it would be great to aim for 3 times a day for 3 minutes each time. Strategies to do this would be setting alarms. If you come and see the pelvic physio here, they can set you up with an app that helps you to do this and help guide you through it, importantly. But otherwise, I recommend putting on a song that takes about 3 minutes. You can't overdo belly breathing, so if you can do it more throughout the day, that's great. So typically what I might recommend is that you're taking 3 to 4 seconds to inhale, you're having a little pause at that end of the breath, and then you're exhaling and relaxing. And if you want to see if your pelvic floor is softening and relaxing, a strategy for that is you see this person sitting on a rolled towel. So if you sit on a rolled towel like this, you might be able to feel that when you're belly breathing, that your pelvic floor just kind of softens into that rolled towel a little bit. You've got to have it right under there. Or you could try sitting on an exercise ball with your legs quite wide, but it's got to be, that ball needs to be right underneath what we call your perineal area. You can also use a mirror and look and see, ideally when we have belly breathing going well, what I'll usually see is like, it's very subtle, but I'll see this slight, so let's imagine we're breathing in, expanding belly. I'll just see this slight softening, and then it will kind of go back to its default higher sitting position. So you can use a mirror for that as well, but I recommend if you're doing that your back is relaxed against something. If we're holding ourselves up and we're tensing our abs, we're probably not going to be as effective in relaxing our pelvic floor. So we recommend that before you come into the clinic that you've tried this during a flare or a spasm if you're in pain, and let us know how you go. Now, another thing to go through is, can you feel your pelvic floor muscles tensing, squeezing, and letting go? That is something that we can teach you, and it is a very important element of managing pelvic pain. We've looked at research on what's most effective, and down training and relaxing them is important, but it's also important to bring in some contracting and relaxing as well. So if you feel comfortable, this is where you would benefit. You could sit on this rolled towel as well, or look in the mirror to see if you can squeeze and letting go. And I encourage you to do this with your breath. So for example, and this is called contract relax. This is something we give people as well. So for instance, you'll go Widen your belly, breathing in, relaxing pelvic floor. And then on the exhale, that's when we bring in the pelvic floor contraction. And then we relax the pelvic floor and widen belly, breathing in. And then we exhale and bring in that contraction. So that's another exercise we often will give. Some things we want to know is, can you feel the movement at all? Can you see the movement? If not, we can help you troubleshoot that as well. And if you're having pain, or if you're able to even do a bit of a body scan throughout the day of, what am I doing with my muscles? A lot of people with pelvic pain realize that they're actually tensing their muscles. And so that's where we want you to just let them go. And when you practice turning them on and letting them go, you'll get better at that as well. So there have been many patients where I've recommended setting a reminder for nearly like every hour or two, just so that they can check in with themselves and give their body the opportunity to let go and soften their muscles. When you can see this picture with the ripples, so the reason why we have that there is sometimes it can help people, rather than thinking about letting go and relaxing, sometimes it can help people to think of just like softening at the area. And often the softening happens first at the entry, and then the surrounding muscles will soften. So sometimes people just, it really helps them to visualize something, and that's where you can think of the entry of the vagina softening and the muscles even all the way through to your glutes or those sitting bones, like right here. So we want to see the softening, and it just progressively softens to the surrounding areas. Okay, that's it for this slide. So to follow on the last slide, these are positions that actually help slightly stretch your pelvic floor and open up the pelvis. You can do your belly breathing in these positions, and you might actually feel more of a sensation down there because the muscles are on a slight stretch. Often, if people don't feel like doing a stretching exercise, I might even just say, look, if you can, just get into a position of comfort or rest. This supported butterfly position down below is really helpful to open up here just slightly. It slightly opens up the pelvis, and it can help just decompress anything that might be causing discomfort. Some people can do it without pillows, but I highly recommend, if you feel any like uncomfortable stretching, that's not a very comfortable position of rest, is it? So you can put as much pillow support as you need underneath your pillows, or quite a wide foam roller, that would work as well. Positions of rest can also be in like a gentle child's pose with pillow support, even like using an exercise ball. It's something that you feel is really comfortable, that you can just fully relax into, and often it might involve pelvic opening. If you need to, even side lying can be helpful as a position of rest, not quite curling in a ball, but just laying on your side, doing some belly breathing in that position. A lot of people find that the alternative is curling into a ball or sitting, and that causes further compression and compression of your hip flexors as well, which we want to try and open up the inner thighs, the hip flexors, and decompress these area for parts of the day.